धन्यवाद अभय जी। तो जैसा कि अभय ने आपको अभी बताया, नर्सों एवं पैरामेडिकल की रिक्रूटमेंट में आने वाली बाधाओं पे यहाँ हम इस कार्यशाला में चर्चा करेंगे। इनके कई पहलू हैं। इन पहलुओं पे और डीप डाइव करने से पहले आज हमारे साथ कुछ अस्पताल जुड़े हैं जो हमें रिक्रूटमेंट में आने वाली इन भिन्न दिक्कतों के बारे में अपने दृष्टिकोण से बताएंगे। इसके लिए मैं सबसे पहले मेट्रो हॉस्पिटल से डॉक्टर कनक लता और डॉक्टर प्रवीण को मंच पे बुलाना चाहूँगा। डॉक्टर कनक एंड डॉक्टर प्रवीण हमें डिस्कवरी ऑफ कैंडिडेट्स यानी सही कैंडिडेट की खोज के बारे में और उसमें आने वाली दिक्कतों के बारे में बताएंगे।
नमस्कार सभी को, a very good afternoon one and all respected dignitaries. I, Dr. Kanak Lata, Director of Education from Metro Group of Hospitals and Education, along with Professor Praveen Prakash, Principal of Metro College of Nursing, on behalf of Dr. Purushottam Lala, Chairman and Founder Member, and Dr. Sonia Lal Gupta, our Managing Director, are presenting today's PPT, our opinion on the bucket discovery. I am very thankful to this platform. I am very pleased to present our opinion and grateful to the committee who has arranged this platform for all of us to strengthen our education system and the recognition of nursing students and paramedical professionals. The Mission Niramaya Campaign, which emphasizes on increasing the quality of education in nursing and paramedical colleges. And I would like to extend my gratitude to our chief guest, Dr. Sanjeev Mishra, VC Atal Bihari Vajpayee Medical University, and Dr. Alok Kumar, Secretary cum Registrar and UUP State Medical Faculty, and to the Mr. Alok Kumar, Principal Secretary, Department of Medical Education and Training. Thank you so much, sir. You have provided us wonderful platform and shown us, guide us to prepare this PPT on the current landscape and challenges in recruitment of nursing and paramedical staff. As per the guideline given to us, to choose one bucket, we have chosen discovery, and this is the outline of presentation to move on. Firstly, I would like to introduce our metro group, then the problem statement under discovery, then the general process of discovery followed by metro group, then the breakpoints, removing the barriers, then deep dive in the breakpoints of discovery for the enhancement of recruitment of nursing and paramedics staff, and finally the conclusion towards meeting the challenge in recruitment of nursing and paramedical staff through discovering the ways and means. Now coming to the problem statement, we believe the reason behind the more difficult recruitment environment include a lot of advertisement agencies are working, a lot of job portals are working, though this is advancement, but that the professionals are very much less accelerated. Less number of eligible applicants are also there, which we are realizing that the number of seats can be increased in each eligible colleges, so that the more and more students can be enrolled, so that the vacant seats in the eligible posts can be fulfilled. The lack of needed appropriate work experience is also one of the focus area. Competition among the employers could be the reason. Candidates is having lack of technical skills, which is very much desirable these days, and the inadequate seats in the education is there, in paramedical education also. International and government job opportunities, though it sounds favorable and good, but this is the challenge actually for a particular state to get good candidates and to saturate our vacancies. The general process which we follow at Metro Group is under the discovery. We advertise our vacancies in newspaper as well as in online job portals. We do give importance and weightage to the referral candidates to become employee. And yes, of course, we hire professionals from across India.
नहीं चल रहा है, ऊपर से जाते हैं, ऊपर जाओ।
If I talk about the breakpoints through the bucket discovery,
और करो।
we understand removing the interstate barriers could help us in breaking this barrier. Secondly, standardized protocols should be followed for each and every college as well as hospitals. Thirdly, lack of defined cadre structure, which we feel very strongly that in other professionals, we generally missing the cadre specializations and clarity among the nursing professionals and paramedical professionals, which can be structured well to address the problem. And of course, career progression towards hierarchy to be addressed here. Yes, under the discovery, removing the interstate barrier के अंदर जो हमने बोलना चाहा है, it's need to initiate pan-India registration could be the solution. As we discovered, the reason of interstate movement of registered nurses is the hitch these days. So if there would be a pan-India registration, may solve this problem and will get adequate staff. Fostering the registration of a state council, verification and registration process via online would help to do the process very faster because one faculty moving from one state to other state, or nursing staff getting 2 to 3 months normal time span to get registered again from one state to other state. So this can be addressed if it would be online or the system can be speed up. Reciprocal process of interstate registration via NOC can be done and initiated. Uniform tracking system for all state nursing councils under one umbrella may be the solution. If I speak about standard protocol, I would like to address like regulatory bodies and associations must work to reach goal related to the state nursing council registration, like registered nurse as per the criteria of their education, because sometimes international eligibility they don't recognize RN, registered nurse for the GNM candidates. They expect LPN registration under the LPN category. So if we will start registration of nursing professionals under the heading of registered nurse, licensed practical nurse, then the registered psychiatric nurse, registered midwifery nurse, as we are following still the previous system of, given by the INC. So this is my humble presentation today. We can change and we can take initiative about the same. Indian Nursing Council has considerable contribution in NRTS so far, but it is National Registration Tracking System, but it still has a long way to go in completing the registration process, where a state nursing council can take initiative collaterals for interstate registration and NOC online process. We are still following the previous system. So again, my humble submission, we can reframe the whole system, and after redesigning, implementation can be done to track the systems, where are how much nursing professionals are registered, in which state it is, and how the migration from one state to other state would be easier for them. Where the vacancies are more can be hired for other state. The lack of defined cadre structure is also, and career progression is also a big hurdle because of the lack of uniformity in the progression of nursing staff is missing. They don't have clarity on their mind to how they are going to be raised in hospital duty or how? Yes, in academic it is defined, but so far it is concerned with the hospital. It is somehow not very clear, not implementing. Adequate representation of nurse in policy and decision-making posts at a state level need to be revised so that more and more nursing professionals can take the senior positions in policy-making department of state. The equal opportunity for nurses for top leadership roles in ministries, directorates and institutions can be offered. Implement National Nursing and Midwifery Commission with a strong provision of nursing practice laws can be the solution. Next slide. Now I would like to conclude my presentation that nurses are the head anchors and lifeline of healthcare organizations. We all realize, but still lack of recognition we do feel. Nurses need to take leadership and proceed to participate more at higher levels to bring a change in the existing scenario of nursing professionals. Need a state nursing council recommendations and visible implementation of laws and policies. I hope I have justified my opinion to present among all the dignitaries. Thank you so much.